All right, welcome everyone to our April webinar. Our topic today is denials, delays, and discouragement, challenges in accessing healthcare. My name is Lynne Kinst. I am the Executive Director of the Bleeding Disorders Council of California, and we thank you for joining us this evening for this important topic. I've been in a lot of meetings over recent weeks with a lot of colleagues from, patient advocacy groups across the country in other disease states, as well as in bleeding disorders. I've been with providers, patients, and this is clearly one of the biggest topics of our time right now. Just as we address some of the inequities and the barriers. So first of all, we are translating this meeting into Spanish. So if you would like to access the Spanish translation, the information is on your screen, and we will also put that information in the chat. And here are the instructions for if you're on an iOS, an Apple phone, or an Android device. Okay, just a couple of quick announcements. We would encourage you to use the chat throughout the presentation to ask questions, to respond. Feel free here at the beginning to introduce yourself if you'd like, or add comments. There will also be opportunities for people to, raise their hand and unmute and comment as well. But again, the chat is a great way to communicate throughout the presentation. We do ask, excuse me, that if you are not, called upon to speak, that you keep your phone or your computer on mute until you're called on, and you can use *6 on your phone to mute and unmute. Just a disclaimer that neither the Bleeding Disorders Council of California or any of our speakers today are providing medical advice or legal counsel. This is especially important today. We are going to have some patient stories shared, and we never want to conflate another patient's experience with medical advice. You always want to consult with your doctor and your care team about any particular treatment advice for you personally. And then lastly, as you were notified when you entered the meeting, the presentation is being recorded, and we do have this available on our YouTube channel at a later date. All right. Just a few quick reminders if you are new to the Bleeding Disorders Council of California. We are a nonprofit organization that coordinates advocacy with 5 other California bleeding disorders organizations. Our focus is statewide access, education, and advocacy on behalf of individuals living with bleeding disorders, as well as other rare and chronic conditions. And our advocacy is to promote access to care, progressive treatment options, and advance the quality of life for people with bleeding disorders here in California. So, I wanted to begin with a question for all of you, and feel free to pop responses in the chat if that is, if you're, as long as you're not driving. And so, if you can go ahead and, put those in the chat. What are some of the barriers that you're facing when you seek to access your healthcare? Anybody want to shout or feel free to unmute and just shout it out as well? What are some of the things that, maybe you've experienced or a family member has experienced? It could be somebody with a bleeding disorder, or maybe they don't have a bleeding disorder. Um, I shared an example the other day, and it has nothing to do with bleeding disorders, but I was trying to get a CT scan ordered that my doctor had ordered, and I sat on hold for 50 minutes going through the process just to schedule this appointment. So, you know, it can be a very long process. Um, so Muriel in the chat, receiving critical medication in a timely manner. That's a big, big one, right? Like, so important. Finding the right provider who will listen to you and really hear your uh, concerns. That's a huge one. What else? What are some of the other barriers that folks have? Prior authorization. Yes, that is a huge one. Um, Denial of a medical service after the doctor performed it. Ooh, ouch. Yeah, that's terrible, right? Um, Sometimes you get that authorization or you think you had that authorization, and then after the fact, it's like the insurance company pulls it away, and then you kind of get stuck with the bill, and that's scary. Lots of examples. I don't really want to call them good examples, right? Because I mean, they are good examples of what actually happens, but they are no fun to experience. So, and finding providers who accept GHPP. So, GHPP is the Genetically Handicapped Persons Program. If you haven't heard that before, and it really does help a lot of folks with bleeding disorders. Did someone had something they wanted to add? Okay. So some examples, we've talked a lot of these like sort of broad categories of issues that people face accessing their healthcare. We've got insurance barriers, all kinds of examples of those that were raised, right? Denials, pre-authorization, um, providers. So there were several examples of that, right? Providers that are knowledgeable about your bleeding disorder, providers that will listen and really kind of hear what your concerns are, providers that are located near where you live. Um, and then providers that will take, and the specific example was GHPP, but it could be your insurance, right? Like finding, maybe you're trying to get to a hemophilia treatment center and they are not under your medical plan, right? Yeah, and this is really an interesting one in the chat. The PCP, so primary care provider, is so difficult to get a hold of by phone, so cannot get through to request an appointment or a referral. And one of the things that I have heard from providers, they made a comment, you know how much they sort of try to push us into those electronic portals these days. And one of the providers said that the reason that he has to encourage patients to communicate with him through his electronic portal instead of by phone is because his staff is spending so much time on the phone dealing with the insurance companies that it like basically ties up the phone lines in his office. So that's an interesting twist on thinking about like why it's so difficult to talk to a provider or a provider's office these days. So um, all of those are, important examples. So to jump into this a little bit more, we have a patient on the line with us who's going to share his story. Um, and would love, Daniel, for you to just introduce yourself briefly, and tell us a little bit about some of the challenges that you have faced accessing medication.
Hi. Hello, everyone. Thank you so much, Lynn, for having me come on here. So a little bit about my history and my experience as a patient and someone living with a bleeding disorder. Um, Originally, before I was on the Kaiser Permanente healthcare plan, I was seeing an HTC, Children's Hospital of Los Angeles, and we were. My standard dosage was from when I was a little baby, diagnosed at 4 months. It was 50 units per kilogram. And that's what I believed would be the standard of dosage throughout my entire, hemophilia journey. And whenever I transitioned from an HTC, and I went on to Kaiser, my dose was reduced by half, nearly half, around 26 units. And yeah, I wasn't necessarily sure as a 19-year-old, 18-year-old, what this necessarily would mean until I guess I just started to, exercise and I guess commit my body a little bit more to the day-to-day tasks. And I brought this concern up to my hematologist at Kaiser, and she coordinated with the hematologist at CHLA, my prior HTC, and they agreed that I needed to be on the 50 units per kilogram. And um, she would write me the referrals so that I can go receive this this dose. And the way the system at Kaiser at least worked was that they would send the referral to the pharmacist specialist at the time, and they would then give me my medication. And however, it wasn't ultimately up to my hematologist to, have the final say in what my dosage would be. It would be ultimately up to my specialty pharmacist, and the dose remained the same, around 26. And this became increasingly hard as I, wanted to continue with, again, going to work, going to school, just living the day-to-day life, and even doing, just exercises outside of kind of my regular daily routine. And it wasn't, and it wasn't until I had the very, an opportunity to fundraise for the Billion Shores community at a bike marathon that I realized, okay, I really need to have this a higher dosage. I mean, 50 would be ideal, but 50 units would be ideal, but any increase would make me feel both safe, make me both feel, confident in my factor levels that I am able to train and condition without a worry that something would happen. So I asked my hematologist, and again, she agreed, continued to write the referrals, but the specialty pharmacist didn't necessarily agree. And so, in order to justify an increase in dosage, she would have me go to get routine factor testing, coagulation factor testing. And it wasn't, and mind you, I've always known that, and I've always been taught that I need to treat in my bleedings, whenever I feel that, I either prophylactically or if there's an emergency, then I, treat it right then and there. And for her to say that, to justify the increase, I needed to go get dosage and to prove that I was actually bleeding or having any severe bleed. And this made me feel super, unconfident about just kind of this journey of should I even bother asking her? Should I even bother with, continuing this bike marathon that that I wanted to be a part of? And, would it even be possible for me to even exercise or do something to this kind of physical commitment? Um, th- the one thing that I would say from this experience that was super hard to deal with, just kind of having the feeling that I didn't understand my own body, and I was basically being challenged about what I had learned from the community events and from what my doctors have been telling me my entire life on how to manage my hemophilia. And they just didn't necessarily listen to a thing that I have to say. And although I, understand the importance of factor testing, I just felt that in this instance, it wasn't necessarily something that benefited my care. Um, Unfortunately, fortunately, I continued with the bike marathon. It was great. I did it even with the low dosage or not, not a significant increase. And it wasn't until I aged out of that insurance with Kaiser that I ended up transitioning to GHPP. I was able to see an HTC again, and without any hesitation or any, second opinions, I was able to get that immediate increase in factor dosage. And um, I guess my day-to-day life has been, nothing short of just amazing since then. So I would say, just feeling that confidence of, I am able to take care of myself. I'm able to continue with the extracurricular activities that I want to participate in without any concern that my health may be at risk. And yeah, that's my big experience with with Kaiser.
Thanks, Daniel. So Daniel and I were chatting a little bit right before we got started here, and I had asked him a follow-up question, and I'm going to ask it again, and that is like, when you were on that lower dose, did you experience more bleeding, or more symptoms of bleeding than you feel like you are now experiencing on the higher dose? And what would your answer to that be?
Absolutely. I would say that for, prior to going onto, this new insurance, prior to my HCC, they had told me um, that whatever, I'm sorry, I was just reading a question. I can answer that later. I was always told that for any bleeding that I had, whether it was a bruise, it was a welt, or it was just anything that could be even just a bump on the elbow because of a doorknob, I can, that is a bleed. I was told that should be considered a bleed and I should treat it. When I was under Kaiser, I definitely felt that somehow, or I just felt that the bleeding that I had would be minimized. I did have welts, but I felt that, or I would have bruises, I would have, swelling, but because it wasn't severe to what, the standards of Kaiser would consider it to be a severe bleeding, I felt that it wasn't necessary to bring it up, that it wasn't a bleed, that this wasn't, something that, oh, it's just something that hemophilias deal with,
Right.
hemophiliacs deal with. So yeah, I would definitely say that, there was a kind of I maybe it was unconcerned with minor bleeding, but it definitely felt that it wasn't something that was adequately looked into, and just, it wasn't a concern for the doctors if it wasn't actively hindering my life, I would say.
Right. Which is such a like sliding scale for people, right? Like, what we were talking about was it's not like that isn't normal. Like people shouldn't be having like joint swelling all the time and this crazy bruising all the time and all of that, right? And it's almost like a form of medical gaslighting that they're minimizing your they're minimizing and they're kind of trying to tell you like sort of like don't bother us unless it gets to this like certain point of you hit this certain level of inconvenience or pain or in order to get help, which is really counter to, like you said, counter to what we teach patients across the bleeding disorders community, particularly if you're being treated by, trained hematologists at the treatment center. So, yeah, and there's a great question in the chat. The for those that maybe don't have access to it, it was asking was the denial, and I mean in Daniel's case, to be clear, they weren't denying treatment altogether. But they were, he was saying he was asking for an increase in the dosage and the amount based on how he had been previously treated prior to being at Kaiser and based on his symptoms, and they would not approve the full amount that it really should have been. And that was the pharmacist in that system. So it's a little bit different, and that's one of the things. Kaiser is considered to be an integrated health system. And because of that, in an integrated health system, the pharmacist has a little bit more leeway to essentially override the dosing prescription that the doctor may or may not have written. So, one more question, and that is, did you ever write a complaint to Kaiser during that time? Like, did you ever file like a form of, no, you brought it up with your doctor, but did you ever like formally file a complaint or an appeal?
I don't think that I officially did. I may have like written one very early on, like as soon as I had um, enrolled into Kaiser, and because nothing happened, I never followed up with it. And I
Yeah.
might have written it one time, and it must have been with the help of my mother because she was also, advocating for the same thing. Um,
Yeah, absolutely. I mean, that was a time that at that time you were still kind of under 18 and
yeah.
your mom would have been more, your parents potentially more involved in that process. So, um, thank you, Daniel, for sharing your story. And we're gonna kind of talk a little bit more about like how we can all learn from that example. Um, we had another patient that was hoping to be on tonight and share their story as well. Unfortunately, was not able to rearrange work commitments to be here. So we're gonna work on recording that story at a later date so that we can make it available to people. But I'll just give like a quick summary because it's a little bit different kind of example and is really a shining example of the tenacity that it takes to get care sometimes as a patient in our community. So this patient is involved with Medi-Cal managed care, meaning that, there's a managed care plan and they get to decide, Medi-Cal basically dictates what is covered by policy decisions, but the managed care plan can kind of decide like where, like with what providers, right? And because it's a managed care plan, there are certain providers. Well, in this case, there was not a affiliate treatment center identified to see this patient as an adult. And so he went through four different hematologists that his managed care plan kept referring him to, all of whom were not qualified to treat bleeding disorders. As somebody, I think, mentioned this in the chat earlier, you get referred to a hematologist. Well, many hematologists practice more oncology, where they work on patients that have various forms of blood cancer. That's their specialty. That's what they have expertise in. And so they often really are not familiar with hemophilia or von Willebrand's or one of the other factor deficiencies. And this was the case. And so kept getting these different referrals, and he had to go through four different physicians before finally he found one that still said, "Hey, I am not qualified to treat you, but I want to take the time to help you try to get the access to the care that you need," and was willing to take their time to get on the phone with the health plan and the patient, and in this case, the UC Davis Hemophilia Treatment Center, and the patient finally was referred. But you can imagine the amount of time, frustration, fear, lack of access to care during that whole process. And, whenever I hear stories like that from patients, I really have two primary thoughts. And one of them is like, way to go for being so tenacious and keeping at it all the way through until you were able to get the access that you needed. But two, I'm always thinking there are probably dozens of patients out there who have had similar experiences and gave up before they got access to the care that they needed. Because it gets very difficult to kind of keep fighting through all of that and get to where you need to go. And I know from personal experience, a lot of times you just get discouraged. And so you don't kind of keep at it. So, with all of those stories, we're already kind of running out of time. So I'm going to run through a little bit of this a little bit quickly, but I just wanted to remind everyone who was listening to our stories just a couple key points about so the National Bleeding Disorders Foundation has a medical and scientific advisory committee. And NASAC has indicated that comprehensive care for people with bleeding disorders should include, at minimum, these five things: a hematologist, and I would sort of asterisk that to say, a hematologist that understands bleeding disorders, a nurse or nurse practitioner, again, who understands bleeding disorders, a physical therapist, a social worker, and 24/7 access to specialized coagulation labs. So again, we know the lab work that we have to do is a little bit specialized, and you want to make sure that the lab that you're being referred to actually has the capacity to run those specialized labs. And so, take a moment to think, are you actually receiving comprehensive care in whatever care setting you are at? Some care centers have all of those things plus more. Um, those really are kind of the minimum for what a hemophilia treatment center is supposed to include. And our treatment centers in California are great. You should be getting all of those if you are at one of our treatment centers here in California. But if you are outside the hemophilia treatment center, you may or may not be receiving all those supports. Okay. This gets a little bit technical, but SB 389 is a bill that the Bleeding Disorders Council of California sponsored and helped get passed in 2012. And it really specifically relates to pharmacy services, and how we get our medications delivered to us at home. And it's about having access to all the available therapies that might be prescribed. And it's about getting all the necessary, like when we say ancillary equipment, we mean things like, alcohol prep pads and syringes and sharps containers, like all those things that you need. And, um, and so that's all, critically important. And one of the things that's interesting that, I've brought up with a number of our Kaiser patients, and some of them hadn't thought about that before, is that generally speaking, Kaiser in California at least requires you to come and pick up your medications if you're a bleeding disorder patient, whereas most other people receive them in the mail. So, that was a good question in the chat about access to medicine as part of the MASAC guidelines. There are a lot of MASAC guidelines, so there's definitely information that goes into more detail than what I just touched on, a very small part of it for the sake of time. But yes, on the NBDF website, you can get all the different MASAC guidelines, and you can pull the ones that are appropriate. There's specific like hemophilia ones versus VWD ones, etc. So those can be a resource that you could share. For example, if you are filing an appeal to your provider or your insurance company, that would be a great resource to include. And I can help offline find those. So again, the question to ask yourself, is your factor or non-factor replacement product delivered to you at home? Oh, yes, the DDVAP question. That is that is a big one. Um, so the challenge that we have had with DDAVP since it stopped being officially made as Cymate, is that some of it is now what's considered to be a compounded drug, and CVS is one of the places where they will not dispense compounded medications. And so we have found workarounds for a lot of people, um, and yeah, I see that it took a long time, but eventually I think it looks like you got to it. But yeah, I've been able to help patients get it through one of the treatment centers in Southern California as well, because it's been a whole thing with Stymate being taken off the shelves, and then it's a really important medication for a lot of our patients. So that there's a long story there. Okay, I'm going to skip over transitions because I want to make sure we get here to the heart of this here at the end before we have to wrap up. And that is, what do you do when you have an issue, right? And you need help resolving it. So, talk with your provider. Depending on the circumstances, your provider may be able to help. Now, obviously, if it's an issue finding at a provider, or your provider isn't qualified or something like that, then that's not going to be the person to talk to. Phone a friend. When I say phone a friend, I'm meaning that there are lots of resources in our community, right? Other people who you know who have a bleeding disorder may have experienced this similar issue before, and they may have found a solution and they can help you navigate to that. Your local chapters throughout California are a great resource to helping you navigate these issues. We here at the Hemophilia or Bleeding Disorders Council of California, we are here to help you navigate these issues. So reach out. Don't try to solve the problems on your own, but get support and get help, and we can help you navigate those things. You can file an appeal. That's typically in the context of like an insurance company. If the insurance is denying something, you can file a complaint. That's typically more in the process of maybe filing a complaint with the entity where your provider is. You can write to a legislator, and then telling your story is a really helpful way that we can overall kind of change things for all of us, right? For everyone who's struggling with these issues, whether it's through legislation or regulation or just gathering all the stories together and showing a provider or a system that the care that they're providing isn't adequate. So we're gonna throw into the chat a link to our patient healthcare survey. And we have this survey in English for now. I don't think, Andrea, we don't have the Spanish link ready to go tonight. Is that correct? She may not be able to unmute. Um, but we are going to have it in Spanish. If not tonight, we will soon have it in Spanish and we will send it out. Now, I will note we are going to be bringing the survey around to community events. We recently shared it at the Central California event, like a little over a week and a half ago or so. So if you have already completed the survey, you do not need to complete it a second time unless you have a new issue to report since the last time you completed it. So unless you have new information that you want to share, you do not need to complete it more than once. In fact, we would prefer that you not complete it more than once per person, per patient. If you have multiple bleeding disorders patients in your family, like if you're a parent, excuse me, for example, that has more than one child uh, with a bleeding disorder, you could fill it out on behalf of each one of those patients. Okay, so we have the English digital patient survey in the chat if you want to fill that out. I also just want to encourage people to kind of keep watching your emails. We will be having a virtual advocacy day late May, early June, and then we have our fall advocacy days coming up in October. I also have a couple of action alerts for people to see. We currently are urging Congress to reinstate the Division of Blood Disorders at the CDC. So you can take a picture of that or scan that QR code, and it will take you to the link where you can do that. And then you can also do this is a second action alert that is urging that your senator to sign a Dear Colleague letter to protect bleeding disorders programs in the federal budget. So that was a lot of information pretty fast at the end. Does anyone have any questions um, for us? About this or about the surveys. And then I want to give everyone a moment. We do have the English and the Spanish surveys in the chat. And then if you weren't able to get a picture of the QR codes because maybe you're on your phone, Andrea's putting those links in the chat as well. Anyone have any extra and additional questions or comments?
That survey English version, the first question asking about whether we have the What's our current care include the following? We can only select one bullet, not all the above,
Okay, we'll have to check that out. Thanks, Sean.
because that's definitely have multiple selections, right? So
Yeah, there should be multiple selections there. Yeah, you should be able to see all of them unless it's just
I
showing
cannot
it.
click. When I click on one, the other one disappear.
Oh, interesting. Okay.
Am I the only one with the problem?
Oh, you're right. It's only letting you select one of the list. It's not letting you select all of them. I see what you're saying. Let me see if I can tweak that real quick. Okay, any other questions? Well, give us a few minutes and we'll get that question fixed. But if you can just keep that link on your computer, that would be great. And then you can finish it in a little bit. Uh, um, and also, we will also send out the links in a follow-up email for everyone who is here and everyone who might have missed it but signed up. So if you're not able to keep the link open, we'll get that out to you as soon as we fix it. Any other
Okay, good.
questions? All right. Well, thank you all for joining us tonight. I lost my slide here for some reason, but if anyone has any questions or issues, I will put my email in the chat and feel free to reach out if we can help you with a specific issue, denial or other type of issue that you're having that's impacting your ability to access care. So thanks for joining us tonight.